Join 3, 2, 1, and we're live. We are now live. This is TikTok Live number 50. We're at 50 lives, ladies and gentlemen. What's everyone doing on their 3-day weekend off? It's President's Day. It's February 17th. How are we doing? 29 p.m. Top 5 listeners who listen to the longest on this episode, TikTok Live number 50. I'm going to be giving you guys a shout out in the comment section, the caption in the podcast and YouTube, all right, when I put the full version out. All right, friends, let's get to it. First person in the chat here is Chase Gundersen. What's going on, Chase? Chase is on an externship. He said currently on an externship. Chase, where are you at? What externship are you on right now? I remember I externed at Montefiore first. That was in July of 2021, in the height of COVID, actually. Mention it. Then in August, late July was NYU, and then first week of August, I think, was VCU. Excellent externship. Oh, here we go. Chase said Cincinnati. All right. Oh, Cincinnati. You're with, who are my dudes over there? You got, mentioned the two of the Chiefs. Why are their names skipping my mind real quick? Mention the Chiefs that you're with, Chase. I forget the names. I got to give them. I saw them in Orlando. They're awesome. They're tough. They're tough Chiefs that they got over there. Betty Menefee joined. What's up, Betty? Chase, who are the Chiefs if you remember right now? Oh, God. I forget their names. Ami said, I'm having a dilemma on what to do for summer third pre-dental. Well, you could do a couple things. You could work at a dentist's office. I think that's probably your best bet. You're in your third pre-dental year, so you're going to start applying to dental school, right? So you could get accepted and then finish out your fourth year of undergrad and then go right into school. So yeah, as a third-year undergraduate student, you might want to consider thinking about studying for that DAT. Otherwise, working/shadowing at different dentist offices in your area. You can go. Liz said, I live in Orlando. What's up, Liz? Yeah, I was just in Orlando back in September for the oral surgery conference. Yeah. Amia just got the number 2 gifter badge. Awesome. Amia, does that help? Let me know what you think. Scott said, how do I get over imposter syndrome? Well, the biggest thing with imposter syndrome is it comes up with a lot of the anxiety of when something's about to start. You're about to start dental school or you're about to start residency. And imposter syndrome is really just anxiety, right? Like you're not sure how I got here. Am I going to be able to do this? Am I qualified? Am I good enough? Yeah. If you're there, you're probably good enough. So you could knock that off the list. And basically just remembering you're going to take this one day at a time. You're not just going to hop, skip, and jump, and you're going to be starting resecting cancer out of the face. It doesn't work like that, right? There's steps in place, and you're on one step of that journey. So just take it one day at a time. Hit that step. Focus only on that step. Don't focus on the things 5 years from now, and you'll be just fine. All right. Let me know if that helps, Doc. Caroline said, "How was the OMFS program at UIC?" Well, UIC is pretty good, pretty cool. You have a great program. You have a decent program there, and a couple of the attendings are awesome. I don't know if you saw the podcast I did back in October. I think it was October with one of the attendings at UIC, who's outstanding. He's an awesome guy. Do you know who I'm talking about? Hold on, it should be right here. We should have it right here. It's Dr. Des Brown. Shout out to Dr. Des. Dr. Brown, he's at UIC, right? So you got some good attendings there. That's definitely for sure. And I know a couple of the residents over there. They're awesome. They're a lot of fun. The Deli just said, about to start clinic in May. How do you start seeing patients with confidence for drill and fills? Well, hopefully you've practiced plenty enough in SimLab by now. And if you're not feeling confident of it, you probably need to get back into SimLab and practice a bit more. Yeah, there's also that, like, you're starting to work on a patient first, but you're not just going to hop skip into working on patient, like doing drilling and filling on patients, right? It's going to start with exams. It's going to start with perio, start with scaling and root planing, cleanings, right? And then the next step is going to be filling. So if you're going to go into doing a filling, like a 2-surface filling, maybe a class 2, I would recommend getting your SimLab a little bit more, get some work in, right? Get that practice in so that, do it a couple times so that when you're working on that patient, you got it down pat. Otherwise, I wouldn't worry about it too much because they're going to slowly get you into it. You're not going to be doing fillings right away. Piano Man said, yo, Brendan, what was your DAT score? My DAT score was a 21 academic average and a 22 on the PAT section. The numbers I remember, it was 24 on Orgo, 22 on Gen Chem, 22 on PAT, I think 20 on Bio. I don't remember the other ones, but they're obviously lower in order to average out to a 21. Alessandro Amato, can you explain RAAS? Maybe another time. Liz said, dang, I missed you. What do you mean you missed? What did you miss? Liz just got the number 1 gift your badge. Awesome. Amia said, what did Amia say? C, it's okay. I don't like to do research. It seems like everyone is doing research or something crazy. Yeah, it does seem that way, right? You don't have to do research in me. You don't have to get bogged down in doing that. I would work on getting that DAT out of the way. And on the other days of the week, maybe you work on doing some shadowing, observing, or if you can work at a dentist's office. That's going to be really important if you're a pre-dental student. It's going to be huge if you could get that in now. Chase Gundersen said, Alec, Logan, and Sarush. Yeah, it's Alec and Logan. Shout out to Alec. Shout out to Sarush. Yeah, they're awesome. They're tough Chiefs, but they're good guys. They're a lot of fun. I had a really good time with them in Orlando at the Amos meeting. So Chase, when you see them this week, tell Alec and Sarush I said hello. I don't know Logan. Hopefully he's cool too. But Chase, good luck this week. Let me know if there's any questions I could answer about externing or that externship in particular. I didn't extern there, but externships are generally like you come in, you try and come in 15 minutes early, stay late, stay until the last person. Always lend a helping hand. That's what you really want to be doing on externships. Jam Bro P7CP. I regret working on teeth for a living, but it's too late. I have to pay off loans before I can leave. I'm sorry to hear that. What would you have done differently, or what would you have gone into? And why do you think that you regret it at this point? User 7356, what are your thoughts on ULSD? What is that? San Diego? Is that San Diego? University something San Diego? I'm not familiar with that. Kat Kimura said hello. Hey, Kat Kimura. Ramon Carrera said, I just feel like I'm way behind in college and lost at what I need to do, and ask who what I need to do. Well, what are you behind on in college? What is your next step? What do you need to do right now in order to feel better, feel more comfortable, feel more caught up? I understand, it's a stressful process, but let me know give me a specific question that I can help you out with. You know what I mean? Detailing _ pro430. What should be my job if I want to work in a dental office, but currently undergrad major in biology? Go work in a dental office. As an undergrad major in biology, I'm sure you have a lot of credits, you have a lot of studying to do, but there might be like one day over the weekend that you could work there, or maybe in the summers you work there, and during the year, the school, you just focus on school. Think about some of the options that you could do, that you can consider. Kat Kimura said, hey, my dentist was doing an extraction and broke the tooth next to it. Oh, that's tough. I'm not going to say that never happens, because it can happen. It also depends. Sometimes those teeth next to them are just, generally you don't put any force, pressure, or contact on the adjacent tooth next to the tooth that you're extracting. Sometimes the tooth is very brittle or broken down next to a tooth that's getting extracted, especially it's got what we call gross caries, or it's got a lot of caries, a lot of decay of that tooth, right? The cavity's really big. So unfortunately, those things can happen. Yeah. And I've had brittle teeth next door to the teeth that I've been extracting break too. Sometimes there's just nothing there. There's nothing holding that coronal structure up, and it just crumbles. And it's like, wait, I'm working on this tooth. How did that? So even just from the pressure on the interproximal bone, yeah, that's happened before. So unfortunately, things can happen like that. Cat camera and made you pay to fix it? Interesting. I'm not sure what happened there. I'm not familiar with that. Susan Marie got a lot of number one gift your badge. Cool. User 1471. I will be going to a school in the West that is unranked but has GPA. Thoughts on if it will help? It's really funny that you mentioned that. I went to Stony Brook Dental School. It's out on Long Island, and they were unranked but had unranked, did not show you what the GPA was, but did have scores on classes. I think that was a really good idea. The problem is that even in that model, where unranked, no GPA, but graded in classes, the students would even judge each other from that. And it was really disheartening to see that and be a part of such a class that would judge each other based on your scores. That really sucked, and I really didn't appreciate that. But that's how students are these days, I guess. It's really too bad, The GPA could be tough. That's really going to make it a competitive. Thank God it's unranked, because I think ranked just makes the school a worse atmosphere. It really doesn't build on the culture there. Everyone just starts comparing against each other and gets competitive in an immature way, because the majority of a dental school class has not experienced the real world. They've gone just from school to school to school. And yeah, it's and then some classes, some years you just get very lucky. The class is really big. You find your friend group. Everyone's just awesome. So it's not all bad. I was saying that it really depends on what you might find there, what you might see. But yeah, you're going to school there. But generally, that should help that it's unranked from my experiences. I don't know your school in the West, but on the East Coast, schools that I know that are unranked, I don't know how UPenn is, but I know how UConn, Stony Brook, Columbia, I believe I could be completely wrong there, because they're pass fail. So I don't know. Harvard is pass fail. And all these schools generally place really high rank percentages of their students into specialties. So it can potentially work in your advantage, just like it did for my Stony Brook year. Amia said, okay, that makes sense. Makes me feel better. If I don't get into research program, it's fine. It is fine. But think objectively. You're going to want to be talking about your shadowing, you're observing, maybe even working in a dental office when you do have an interview at a dental school, right? That's the conversation you're going to want to be having, not necessarily research. Because you are going to be treating patients in dental school, you might not be doing research. Okay, so generally that's going to be prioritized in your interview, and it's going to be something you're going to be able to. You might get interviewed by someone that doesn't do research. Either way, you're going to be interviewed by someone who's a dentist at that school, and they work on patients or have worked on patients, right? So that's going to make your interview go really, really strongly. So Amia, think about that, right? Evie said, in a dream world, what would be more lucrative, owning my own dentist office or MD office? Well, I would say good luck on owning your MD office because it's so corporatized and monopolized at this point in the MD side of healthcare. If you could do that, go for it, right? You're more likely still at this point in time owning your own dental office, even though it's following the trajectory of the medical side of healthcare. Within 10 years, it might potentially be difficult to own your own office in dentistry as well, which I'm very disappointed at because dentistry was for the most part mom and pop shops and owned by dentists. Like dentists were their own owners when I started to look at dentistry 10 years ago. And within those 10 years, COVID, a bunch of things happened, and now it's starting to get everything very bought up and corporatized, which I don't like. I'm not a fan of that because it's a different type of, business model when you're working on patients, when you're working on people. If you're just pumping out toys at Amazon or Toys R Us, whatever you want to call it, it's different, right? They just return it if it's defective or whatever. When you're working on patients, it carries a different level of attention to the patient or the client or the customer, if you will, right? And I really do think that having the freedom and ultimate focus of just focusing on the patient, you can afford at a private when you own your own place. I know you could say that, working at a DSO or at this thing, or you hire out a marketing team to do that work for you. It can, but generally when you work for someone else like that, you're just trying to go in 9 to 5 and get the hell out, right? And I think there's a certain level of compassion with working with patients that comes with the job and the responsibility of owning your own office or your name on the board, name on the office. Just my thoughts. A Patel 7720, Penn or Temple Dental. You put in the parentheses, I'm poor. I know that the tuition is going to differ between those two dental schools. And you can look on the pre-net mentor map to get a better idea of what those tuitions are and whatnot. But yeah, I'm not familiar with Temple. I do know Penn is a decent dental school and they do place a certain percentage into specialties each year. That's important, right? Temple Dental I know is good. I don't know what their percentages are placing into specialties, and I don't know what the clinic experience is like at Temple. Kat Kimura said, should I pay for a tooth broken by my dentist? That's a great question. I mean, I don't know the situation. I really don't know what the situation was as far as that goes. HNM1013. How should you study for the CBSE 6 months out? I would start with boot camp. You could start with, 6 months out, maybe start with Anki, maybe start with Quizlet. I would read the first aid book, First Aid for the USMLE. I guess you can't see it in the video here, but that's a textbook that's really important. I would look into those. You could probably get the Quizlets. I was a big Quizlet studier. You could probably study that book by the Quizlet first to start out, get your bearings. Otherwise, when you're about 3 to 4 months out, I would start with UWorld. I would start with UWorld going topic by topic, learning it using maybe not Boards and Beyond, but you have Boot Camp, you got Sketchy Farm, you got Sketchy Micro, you got Pathoma. Those are some good materials to use to learn the material. And then I would summarize that to re-embed it in your memory by doing the practice questions of UWorld. So again, question by question, the first cycle through UWorld. Once you get the second cycle through UWorld, I would do it randomized. I would mix in some AMBOSS questions on that second pass through UWorld. AMBOSS UWorld, and go like that, okay? And if you're really wondering about studying for the CBSE, I would go to YouTube or podcasts, and I would look for CBSE Dissection. It's a podcast I did with Axe several months ago, and I've gotten so much feedback. People said that is the YouTube video you need to go to if you want to crush the CBSE, okay? That's going to help you do the best you can on it, all right? I promise you. eDog580 said, what were your pre-dental school stats? So I didn't do a pre-dental degree. It was chemical biology that I graduated with from Stevens Institute of Technology. And my stats, I had a 3.6 GPA. My DAT was a 21 academic average, 22 PAT. These are some of the things that I think they all helped me. The school was Stevens. It was a harder academic school generally. And yeah, it helped me get into dental school. User 7356, Louisville. I'm going there and want to know if you've seen anyone in OMFS residency from Louisville. Yeah, there are There are none in this area from what I know, none at my program, but yeah, I am familiar. You know, there are Louisville residents out there. There are residents out there in oral surgery that have come from Louisville Dental School. That's a question you're asking. Tina Thomer said, have you heard of burning mouth syndrome? Yeah, I've heard of burning mouth syndrome. You should look up, this is shout out to Dr. Stephen Roth. He's an oral pathologist. He has a great YouTube video on burning mouth syndrome. I would check it out if I were you. Yeah, that's pretty good. Detailing also burning mouth syndrome. Have you changed up medications that you're taking recently? That's something I noticed. Detailing underscore pro 430. What roles in a dental office should I look into if I'm still an undergrad? Anything. I mean, I just graduated undergrad and I started working for an oral surgeon as a surgical assistant. I was suctioning, I was head holding, I was assisting, setting things up, seeing patients, helping with consults and follow-ups, the whole 9 yards. Yeah, that's what I did in my gap year. You would look into that. A Patel 7702. How important is it going to a prestigious school when matching for competitive dental specialties? It is important, but it's not to say that you can't do it. And then what is a prestigious school when you match? You know what I mean? It's not necessarily only in the name. I would put a prestigious school. I wouldn't fall for the names necessarily. You know, like Stony Brook, for example, we match in UConn. You know, they're state schools, but they consistently match great numbers into specialties, right? So it's not about the name of the school only. It's the whole rounded picture of the dental school that you got to look into. Okay, that's very important. Ramon Carrera, like externships, and I see people the same year as me, and they seem like they are ahead. I wouldn't fall for what everyone else is doing. You know, don't worry about what everyone else is mixed up in, right? Focus on what you're mixed up in. What are you doing outside of just school specifically? That's what you need to consider. And think objectively. Are you getting involved in any research? Are you applying to internships? Are you looking for dental offices to work at? Or have you taken the DAT yet? That's something to consider. Get a good score, and that score on the DAT might afford you different opportunities to apply to other dental schools than those people who did internships. Jessica 2 said, I have a headache for the past 5 days. Do you know what would be the reason? I mean, it could be a million things. And it could be related to the teeth, but it might not be. If you've had a headache for that long, it might not be dehydration. I would consider getting a consultation at your primary care provider, right? Your general doctor. Kat Kimura said it was a healthy tooth according to x-ray. Okay, I mean, that doesn't sound good. The way you're setting it up doesn't sound good, but unfortunately, I haven't seen that x-ray or I wasn't there during the extraction procedure, so I can't give you more details. You know what I mean? Z said, generally, we do consent for damage to adjacent structures, potentially as a risk of procedures, which could involve anything from, the tongue could get hit, the cheek on the outside, the tongue on the inside, adjacent teeth in that area, the nerve under the tooth root, maybe it's a third molar that's being removed close to the nerve. There's just so many things that unfortunately can go wrong in surgery, and you can't control everything all the time. That's one of the things about surgery, and that's why you want really intelligent, talented people going into surgery, because it's inevitable. Complications will happen. You want the best surgeon who's most experienced to prevent complications from happening, and then God forbid when they do, they have the ultimate experience to know what to do as quickly and most reassuringly to fix that problem once it happens, right? That's why we want to incentivize the smartest, most intelligent, talented, brightest people to go into professions such as being a surgeon that works with people, right? God forbid you get cancer. You want the best person to be fixing that, and God, maybe it comes down to surgery. You got to get that removed. You want them to do the best job out there, which means you need the best person doing that. So I don't know. I see a lot of people complaining about how doctors and dentists and surgeons and lawyers that, a lot of complaints about the salary of these. First of all, the salary is a fraction of what used to be back in the day. Okay, that's something you have to accept that now, right? And that's not great. Number two is we need to incentivize people to go into specialties and to go into professions that are working on other people, right? For that analogy that I was just saying with the cancer. And, it's getting tighter and tighter. Doctors marginally aren't making as much as they used to. Look, you could point fingers and complain all at the end of the day, but the fact is, I want you to get the best care possible. Yes, I'm in healthcare, but remove me from the equation. You want the best people working on you when you have that problem at the end of the day, right? Just my thoughts. Ekimura, Amia said, thoughts on High Points Dental School? It's controversial from what I heard. Interesting. Something that is controversial is that they don't take like a DAT, if I remember correctly. I know one of the people that was involved in opening that too, actually. But, it's called Workman High Point Dental School. It's called Workman Dental School, and Workman is the last name of someone who opened up a DSO. So now we have DSO. DSOs are big corporations that own so many dental offices, right? Potentially hundreds. Like, was it not MedPro? MedPro is an insurance company, but you have You have Aspen, there's a couple that have literally hundreds, sometimes even thousands of dental offices. And, now when you have these corporations that own a bunch of dentist offices, now they're opening up dental schools to produce dentists that could go in their dentist offices. This is a massive monopoly loop, and that is just classic conflict of interest. It's literally textbook conflict of interest. But we'll see what the ADA wants to do about it, because this is kind of the downfall of professions and how you really, monopolies prevent new competitors, and it really puts a cap on progression, on performance of an industry, of expansion of an industry, refinement, trials and errors, essentially, to make the profession better. Well, anyway, say that for another time. Alexis Perez Cadena said, any advice for new grad dentist who wants to go back to school for OMFS? Yeah. First, I would get more exposure to oral surgery, right? I would do an externship maybe. The second thing is you're going to have to take that CBSE exam. That's what they're going to compare you to all the other applicants in the country, all right? So I would recommend you focusing on taking that CBSE next. I would consider CBSE and externships to get some more exposure. Okay, that's the next step that you'd want to take. User 1471, yeah, it has a 100% match for many years. I want to go into dental anesthesia. Oh, excellent. Yeah, well, there you go. I think you just answered your question. I hope you laugh said, what is your opinion on dental anesthesiologists? Do you see good job opportunities? I'm not in dental anesthesia, unfortunately, so I don't know all the opportunities that are out there for that. It's a relatively new specialty. It seems to be pretty good. I don't know. I'm sure that you can be hired out at different dental offices and be kind of your own boss, and you can work at this office this day of the week, this office that day of the week. They also have hospital positions for dental anesthesiologists. I remember when I was at Stony Brook Dental School and I assisted on a case in the OR, the anesthesia that was working with the team there was a dental anesthesiologist. So there are plenty of positions. You can work in a hospital, you can work in private practices for dentists that want that greater level of anesthesia to give options to their patients. So you have options. I don't know the numbers of those options though. Dollar sign said, yo, do you think I can match to a 6-year OMFS with a B in dental school? Potentially. What's your CBSE score looking like? I would work on getting that CBSE score because that's going to counterbalance your grades in dental school. Potentially. It really depends on the program that you're applying to, right? Kev followed the live creator. What's up, Kev? Thanks, man. Sarah said, oh, that was a response to the Pinky Face said, what are your top recommendations for dental school? Well, I mean, if you have to take a gap year, I think gap years are excellent. I took a gap year and I got to really see what the real world was like by working in 2 lifeguarding jobs, working for an oral surgeon, learning, reading books on the outside. Otherwise, top recommendations for dental school, are you talking about, you got to define, are you talking about getting into dental school or while you're in dental school? And then what recommendations about what? Can you define that a little bit more for me? Haley Wiener T7 said, what are the top qualities you look for in an assistant? Situation awareness. Number one thing of a dental assistant is, well, number one is probably putting the patient at ease, making them comfortable, always thinking ahead about the patient, number one. Number two, situational awareness. I love a dental assistant. I've worked with so many where they know the next instrument you're going to. They know how you like things on the tray. I always like to take instruments off that I'm never going to use in that case. And not all dental assistants do that. Another thing is like, yeah, your little quirkiness that you have. Every oral surgeon likes these little, or dentist likes these little weird things about them. Like I like to put a little tray nearby for the garbage stuff in the case, like maybe some used gauze that doesn't need to be on the tray anymore. That could go on a little side thing. So situational awareness is understanding what the surgeon or dentist is going to do prior for they're doing in that specific way. That's particular for a dental assistant. Kevin Gao said, any thoughts on Pittsburgh Dental School? Yeah, UPitt, cool school. I did the ASDA annual session there. That was like 4 or 5 years ago. That was a lot of fun. That was an amazing experience. That was in February. It was very cold. Met a lot of people there. Yeah, I mean, I think Pitt's generally very good. I think their oral surgery program only has 1 or 2 spots to match to. I think it's like 2 spots. I know a few people, most people that I met try and match outside of Pitt when they go to Pitt Dental School there. That's as much as I know with Pittsburgh. Haley Wiener T said, what qualities make you a good boss? I think a good boss takes the mindset, and this is a Gary Vaynerchuk quote, when you're a boss, you actually work for your employees. Your employees don't work for you. Yeah, the money flow is one way, but your objective of your position is to lead your team. And to keep a good team, you need to be receptive to their personalities, to their needs, their wants, their goals in their career, right? So I think a good boss would be, you need to be the leader of communication. You need to be able to think of good questions that brings out the best in those assistants, the staff, your team, and be able to kind of work into your, I don't know if it's daily, weekly, or routine, but you want to work in there. You want to be receptive to their wants and needs, right? That's going to be really important. And you need to be able to be comfortable with your team so that they always at all times can come and talk with you. If you're gonna try and lead your team by fear, they're not gonna come and talk to you, and that's a failing environment. That's not the environment I want to have when I hope to be a boss one day. I want people to be able to come to me and ask questions, and know that I'm on their side. So Q just want to say thank you for all the experience and sharing and knowledge sharing. It helps me a lot in choosing specialties, etc. Awesome, thanks for saying that, Q. I really appreciate that. And what question can I help you with? Alex Mayer said, tips for fourth year of dental school, want to get the most out of the final year coming up. Yeah, I mean, it's really just working as much as you can with all the faculty that you can, learning the different techniques and hacks and secrets that different dentists that are working in your clinic with you have learned over the years, and they could shed some light on that for you. They're going to be able to train you. And it all takes place in the clinic. Fourth year, you want to be in that clinic, get that clinic time. Liv said, how much does previous dental experience really help you into dental school? Yeah, well, the experience is going to come down to when you go to have that interview of getting into dental school, you're going to be able to keep a conversation. You're going to know the certain terms and stuff. You're going to be able to really talk about those key dental related things with that interviewer, because they're going to be a dentist and they work with patients. You're going to have worked with patients. It's going to be a different playing field when you have that type of experience of working in the dental office previously, to connect with that provider, the dentist who's going to be doing your interview, right? Shark Attack said, we'll get a 19 on the DT. Will a 19 on the TAT? Shark Attack said, will a 19 on the DAT get you in? I do know of students that have gotten a 19 on the DAT and have gotten into dental school. I would personally shoot for a higher score at this time. Just my thoughts. Daniel said, thoughts on the inferior velar nerve? What are my thoughts on the inferior velar nerve? Yep, well, you want to stay away from that nerve. That's one thing. Two, it's down there. I wouldn't fall asleep on that nerve. It's down there somewhere under those roots or under that implant that you might be placing. But otherwise, my thoughts on that, it supplies sensation to the lower lip, cheek, and teeth on that side. You want to protect that nerve. You want to stay away from it and let it do its thing. Izuku Black Doraya said, is dental anesthesia becoming popular? I don't know if it's becoming popular necessarily. I mean, it's a new specialty. My curiosity would be, what positions are those dental anesthesia residents going into? Is it hospital-based? Is it private practice-based? And how many of them are actually working after they go into dental anesthesia? That's my question, right? Because you could graduate from a residency, but are you actually working? Are you doing general dentistry when you go into work and doing that anesthesia for them? That's my question. I don't know enough about that. Joshua Escobar, St. Anthony's alumni in the house. Josh, what's up? There we go. Shout out to St. Anthony's. This is TikTok Live number 50, by the way. The top 5 listeners who stayed on the longest, I'm going to be wrapping up in a few moments. I'm going to be giving you guys a shout out in the caption of this TikTok Live number 50. All right, so thanks for joining. A couple more questions, then we head out. MB20003. My bottom left gum started bleeding after I took out my retainers. It's probably gingivitis. Well, I don't know, because I can't see inside your mouth. It could be a number of things. It could be gingivitis related. It could be periodontitis related if it's in the back. You said your bottom left gums. I don't know if it's in the front or the back. Could be a bunch of things. Maybe you just got a corn kernel stuck in between your teeth and it's causing some inflammation. I don't know. Charles Wilson followed the live creator. All right, guys, I got to wrap it up. Last one. Here we go. Dev Patel said, hey, man, I followed you for a while. I remember asking you some advice from you. I got into OSU dental school. Wow, Dev, congrats. Awesome. Use this time to kind of travel, enjoy time with friends and family now. You're not going to get that time back. It's going to be very challenging to see them and to do the things you want to do during dental school. So try and fit that in, all right? Blank said, thinking of doing a fellowship in plastic reconstructive surgery. What are your thoughts? I mean, my thoughts, I'm not going to be doing a fellowship in anything, and definitely not in plastic reconstructive surgery. What are my thoughts? I mean, it's very fascinating. It's interesting. I think your mindset changes once you get into residency, though. For many people, it's not what they thought. Roddy said, what's one thing you would say to focus on D1s interested in OMFS? I would work on effective and efficient studying, okay? And what do I mean by that? What I mean is that effective studying is obviously getting higher grades, C, B, maybe get in that A range, and then work on efficient studying, getting the time down that it takes for you to study and get those A's, right? Now you got to get through those Quizlet cards 3 times, then you get it down to 2 times, and still maintaining those A's. That's really important because in dental school, when you become a D1, you're going to be taking an equivalent of 32 credits a semester. You want to be able to maximize how much you can study for in a short amount of time. Okay, that's my answer for you, Roddy. All right, friends, I got to head out. I got to get groceries still, switch out my laundry. And thanks so much for coming on. This is TikTok Live number 50. We made it. We're halfway there, halfway to 100. 50 in. I'm going to be giving you guys a shout out. The top 5 listeners who stayed on the longest, I'm going to be giving you a shout out. I always do. The top 5 listeners in the caption of the podcast and the YouTube channel for TikTok Live number 50. I'm going to let you know. All right, guys, let's wrap it up. Wish you guys a great week. Hope you had a great 3-day weekend, and let's get after it. All right, guys. Love you guys. Thanks for joining.